he ended up in a rehab place where they overdosed him with it, and it, oh my goodness, it was horrible. And so we ended up just taking him off it completely. And then he was on another drug, I can't think of the name of it, isn't this terrible? Oh my goodness. In the very beginning. And it seemed to be helping, however, he had constant jerking. At night, I could not count past 14 that he wasn't jerking. And we went through, they thought it was a sleep apnea or something, so he had a sleep study done and all this stuff. We ended up stopping the medication and it totally went away. It was just crazy. We tried him on Klonopin, he just froze up, could not function. So we've had our share of trials of drugs that have not worked for him.
So was that early medication Azilect?
Azilect,
Yeah.
that was it, exactly, that was it. Thank you.
Yeah, and a lot of people, of course, tolerate that medication very well, but that's one of the issues when you get into these situations where medication is wearing off frequently, and you try different things and you discover which things have side effects for you, even though other people don't necessarily have them. So that's why from Azilect to the Requip.
Right. Well, even on the Requip, at one point when he was on it and things seemed to be okay, he was put on Cipro for a bladder infection. And I didn't read until later, but when you do that, you should have reduced the dose of Requip. And we had a weekend where he was totally out of it, and he actually fell. We have a hole in our kitchen wall where he fell. I mean, it's just, but it was because of we should have come down on the Requip dose, yeah.
And did he have peak dose dyskinesias, involuntary movements and moving around
No.
after his doses?
No.
Okay. Because that's another issue. Sometimes in order to keep people from wearing off, you're giving more medication and you can't avoid having a lot of involuntary movements, and that can also lead to falls and causing other problems. So it's another reason to consider something like Duopa. And the other thing, in my earlier talk, if you were there, some of the other talks, you heard about the extended release capsules with the little time release beads, which can help, and also using drugs like Comtan, Entacapone, either as a separate drug with the levodopa to extend the duration, or you can get a combination that has carbidopa, levodopa, Entacapone all together called Stalevo. And I think we tried to get him both the Stalevo and the Rytary, and the insurance just wouldn't go for it. Am I remembering right?
Yes.
Yeah. So that can really put you up against the wall. So with all of this going on, with the wearing off all the time and the frequent doses, we talked about the Duopa, and you decided you wanted to try that. Do you want to talk a little bit about how you went into that, what preparation and the surgery for the tube?
Yeah. Well, actually, for this tube, we did meet with a GI doctor, and then it was an outpatient procedure. He went in, he had an outpatient procedure, and went home. We had a little issues with the first tube. He had leakage around it, and they did replace it with another, and that was fine. That took care of it. And it's very easy to be. The only thing you have to keep it in the refrigerator, and so we have a refrigerator in our bedroom. So anyway, it's worked very well. And the only thing I will say, if ever you had to go in the hospital with it, take the little connector they have, because it's one that hospitals don't have. And when he ended up in the hospital, you need to flush it at night, and they didn't have anything that would connect to it. And here I'm down at Harper, and we live in Farmington, so it's like, oh my gosh. So I'm all flustered, so I'm worried to the heck all night that it's going to clog up and not work, but it does work if you don't flush it. For one night. I wouldn't advise
Don't
it.
do it too frequently,
Don't do it,
but once.
Yeah, because I was so afraid to go the next morning. I thought we ruined it, but it was fine. But take that adapter with you, because hospitals do not have that adapter, which is crazy, but they don't. Yeah.
Let me just point out, I left this slide up from the earlier talk because it shows what's involved. The tube we're talking about is implanted into the belly, and there's a sort of little Y connection there you can see above the green part. So there's one lumen of the tube that can be used for feeding and so forth. And then the other one has the special connector that connects to this pump that you see the patient holding in their hand there. And the bottom part below the pump, the brown, is the little cartridge that actually has the gel in it that's going to gradually pump into the patient all day long. You don't have to refrigerate it when you're using it, but you have to store the cartridges. You use a new cartridge every day, and you have to store them refrigerated. So what she was referring to is they have a little refrigerator in the bedroom to keep the cartridges in, so when it's time to start a new day and plug a new cartridge in, you've got it right there in the refrigerator. You don't have to go fetch it from kitchen refrigerator or anything
Right,
like that.
it saves running downstairs. Which, because if once I go down, the dogs are up and I have to put them out, and so it's easier just to get it out in the room and get ready and go. It was for ease.
And then, of course, the diagram shows the sort of figurine holding the pump and the thing in their hand. Obviously, Steve doesn't go around all day with the thing in his hand.
No.
They actually have a number of different arrangements for how to wear the pump.
Right, yeah, the Abbey company, they sent us a brochure, and they had several different choices of things you could use. You could have a fanny pack, a vest, which is what we chose. However, a few times I have a fanny pack from other things that we've used for it, because it just seemed more appropriate for that. And then it does come with a thing that hangs around your neck, and it just hangs there. It comes with that, but you get to choose from several different articles of clothing that you decide to use it with.
And you can have all three and use different ones
right.
when you want, as seems suitable. So you sometimes use a fanny pack, but it's not the one they supply.
No, they gave us a choice of one thing, and I'm not sure if
Yeah.
you can order them or not. So I had a fanny pack from a medication I had for my knee surgery, so we just use that periodically, yeah.
Yeah, I don't know if insurance will pay for more than one that you get when you get the device, but I'm sure you can order
Oh,
them.
I'm sure, yeah, you probably can. I just use the fanny pack we have.
Yeah, the devices that, well, the fanny pack in particular I'm familiar with, but I think the vest also, that, you know, they're nice arrangements of zippers and pockets and windows for access to the pump and having the tube come out in a convenient spot and so forth. Sort of like my kids these days all have backpacks that have little openings for their earbuds to connect to whatever goes in their backpack. So it's really, I think, generally for most people quite convenient to wear it around.
Yeah, oh yeah, it's not been a problem, no.
And any other issues with it since?
Well, he did get the tube. When you're not using it, the tube hangs out. It's about maybe almost a foot long, and he caught it between his knees one day and pulled part of it out. So we ended up having to go back into the hospital and have another one put in. So since that, we tape it. We're very careful. We have learned to tape it because it's much easier to tape it than spend 4 days in the hospital.
Yeah. So
it's just little learning curves.
The tube has some extensions, so if you want to wear the fanny pack over on your hip or have your pump on the strap hanging on your hip, the tube has to be able to reach over there. And if you've got something that holds the pump right over your belly, you don't need as much tube. But any sort of tube like this, if it comes out, you have to get it put right back in, because otherwise the body just heals up literally overnight, and then you have to start from ground zero to reinstall the tube.
So how does the pump work? Is he able to, is it just continuous?
Right, it's a continuous. It's all preset. All you do is hook it up in the morning, you turn it on, and it goes through a thing, and then you hit the run. You hit start, and then you give a morning dose, which is like a booster dose, and then after that's done, it goes into a continuous mode all day until you take it off.
Positioning doesn't matter, or if you
Well, occasionally it'll kink. If it's kinked, it beeps at you right away, so you can just go and fix it. It'll beep at you. And so you just hook it up in the morning and off you go. And AbbVie's been very good. They call a week before we're due to make sure. FedEx brings it in the morning. They've always been there right when they say. So it's worked out very well for us. Yeah, and the batteries you change every week. I'm surprised that they don't last longer, but they don't every week. But they send the batteries out, so they provide the batteries. Yeah.
No, predicting battery life can be variable. You don't want the thing to
no.
to run low, so they replace them frequently so that you've always got lots of juice to run the pump and it'll deliver the right amount. And we program the pump in the office, so most people, they don't recommend that you run it all night long. There are issues with that. One, you don't want to get tangled up in the tube in your sleep, but also you don't want stuff when you're lying down running up and getting to your lungs instead of going down where we want it. So just the way you generally stop taking your pills overnight, you turn off the pump and, as she mentioned, flush the tube out for the evening, and cap it with a special connector, and then in the morning you have to hook it back up. And so we program the pump to give a fairly large dose over a period of about 20 minutes or so to get you going in the morning. And then after that, it just keeps feeding more in at a low rate so for the continuous. And then in addition, we have it programmed, we can say what dose, but there's a button you can push for an extra dose in case you do experience some wearing off at times. And sometimes people have better days than other days and they just need a little bit more. You can push to get an extra boost of the gel delivered. And then if you have to be pushing it every day, then we turn up the low rate the next time we program it, so that we try and keep it so it gives you the right amount. But you do have the option of getting a little extra when you need it. Anything else you think people should know about it?
Gosh, I'm trying to think. We haven't gone on a long trip yet, but the company does send you a huge, like a cooler, padded cooler with ice things, little ice things that you put in there, and you can fit, I think a 10-day supply in there. I think so, that's what she said.
Yeah.
We haven't used it yet. We only went on, we haven't gone anywhere that long, but they do have a nice pack that you can carry it in, so that you can carry your spare ones with you, and they'll keep cool. So, and they provide that. They just send it right to you.
If you're going to be gone longer, you can have more shipped to where you are and then switch it back. So.
Yeah, that was my concern, because I'm looking to do a long cruise, and I'm thinking I'm not going to have enough days here.
Yeah, well, if you go on a cruise, I don't know that they're going to drop them off by
know,
drone.
That's what I'm concerned about. Yeah, right, exactly.
I'm sure they'll be able to give you enough to last for the whole cruise.
Yeah.
And talk to the cruise people about keeping it appropriately refrigerated. So other questions? Yeah.
I was just going to ask about the overnight. Do you have to provide any other medication coverage overnight?
Well, we haven't been. The only thing I was thinking that maybe I should do, and I probably should, is give an extra dose before we unhook it at night.
Yeah.
I've been thinking that might be a better idea, because he is able to get up, but he is very much impaired. But so maybe giving that extra dose before we unhook it might be
So how long is your night time? How long is he not on it? Is it 10 hours, 8 hours?
Well, we usually go to bed around midnight, and we started around 10 in the morning.
Okay.
Yeah, because we sleep in. I mean.
Well,
That's our one. Yeah, we're not tired and we sleep in.
But it'll let you start it pretty much when you're ready to start in the morning. And some people do take a dose of something like the ropinirole that's more long-acting or something like that at bedtime if they need to. You're not. It's not like you can't take other stuff than the Duopa itself. And of course, one thing actually we ran into this I think at one point when you were in the hospital. Because you have a tube, sometimes nurses and hospital physicians feel that you should be fed through the tube.
Yeah.
And you can do that. That's why there is the extra lumen. But for many people, there's no reason to use it as a feeding tube. It's there to deliver the medication. And sometimes you have to educate the hospital staff
Oh, I had a
about that.
horrible time with them, yeah, because, well, they wanted to use the port that the medicine goes in. And I fought with them, I said no, and I called the company twice, because I kept telling them what the company, because they had never seen this before. And I didn't want them to screw it up. And I actually called the company twice, and they even made a kludgy looking thing that they were determined to give him 2 feedings. And I had a really fight with the doctor, and I finally said, you know, and thank God they listened, and because you cannot use that medicine port for that, you would have ruined it. You know,
Wow.
so it was very frustrating because they just wouldn't listen to me, you know. So I'm trying to call AbbVie, and it's like, oh my gosh, it was very frustrating. But we made it through.
That's actually one reason why the port that the medicine goes in is different, not just because it somehow needs to be that way for the pump, but because you're not supposed to hook other things up to that port. And there's a regular port that you use for feeding, so I'm not sure why they...
Oh, you know why? Because that was the time it was leaking, and they
Uh-huh.
thought the stomach was leaking, so they didn't want to put it into the stomach.
Uh-huh.
They wanted to use the jejunum port, but that's
Uh-huh.
the medicine port.
Got
And
it.
because they could bypass the stomach.
Yeah.
That was the issue. So I finally told him, if he had abdominal surgery, you would wait till he had bowel sounds. He can go a few days without eating, or getting, because they wanted to feed him because he couldn't eat. It was frustrating, but we survived anyway.
Yeah.
But yeah, you really have to be your own advocate sometime, because people don't understand, because they had not seen this.
Yeah.
And the pharmacy had to approve it before we could give it.
Mhm.
And they hadn't even seen it, so they were going through, but it worked out. But
So the mechanics of the device, is that something, is he unable to do that? Is that something you're helping him with?
well, Steve also has dementia with his
Right,
Parkinson's,
okay.
and he's not able to, so I take care of it.
I have
Yeah.
a dad with Parkinson's, and his wife has had a bad stroke, so I'm just
Yeah.
curious.
Yeah, so I just take care of it.
I have another patient where the patient
Mhm.
can hook it up
They can do that.
themselves fine. We were a little bit concerned that they'd be too off overnight to hook it up in the morning, but I think we're doing okay with that, so. And yeah, it's still fairly new therapy in the US, so that you do run into lots of people in hospitals and so forth who just haven't seen it before. I will put in a plug that, like so many things, it actually has been used for, I think, more than a decade in Europe. So it's not like it's really that experimental. There's a lot of experience with using it. But it's going to take a while for particularly hospital providers who don't usually even deal with that many Parkinson's patients to get used to the idea of some of these things. So. Yes?
What about insurance coverage? You have to fight for that?
You know, we didn't. It was approved. They called us, because I was concerned when he first talked about it, because I looked up online and it's very expensive. And it turns out Steve is on Medicare, and they pay for infusion medication. And so, and it is very expensive, but it's covered 100%. We have that, and we have a Plan G secondary insurance. So between the two, we don't pay a cent, fortunately.
And so from my point of view as a physician, yes, there's nothing you can do these days that you don't sometimes have to fight with the insurance company to do it. But it does seem to be, in most cases, possible to get it approved by the insurance. Yes?
So, I'm a nurse practitioner, so my question is internally, did you say one goes to the stomach and one goes to the jejunum?
Actually, I think it goes down to the duodenum.
Duodenum.
Hence the duo part of the Duopa.
Oh, okay. Oh, I did. Yeah.
So it gets it beyond the stomach to an area where the levodopa is very well absorbed. And you don't have to, you've got less concern about it getting back into the stomach and regurg and so forth. And then like I say, there are two ports, and the other one opens up, I think, actually right into the stomach. But
Okay, so does it have to be installed by a physician that's already, like a interventional radiologist who's already familiar with doing
Yeah.
these, or?
Anybody who installs PEG tubes
Could do
should
it.
be able to do it. And again, many people who do are not familiar with this already. So, but usually if you get them in contact with the company that produces the pump and so forth, they can tell them what kind of tubes and special considerations about getting it positioned in the right place and so forth. So,
Okay.
Oh, and even when we were at the hospital for the insertion, there is a representative right from the drug company who's there, and she comes in, she sees you, she goes into the procedure with the doctor, and then she comes out. So and that's what her job is. She goes to all this. So, and even when he was in the hospital, they came and we saw her. She came there also. You know, so she really keeps in touch with you. And if you have any questions, you can call them at any time, which is nice. Yeah.
yeah, the company that makes the pumps is very concerned that they want to make sure that they're set up right, because otherwise they're not going to work right. And they provide a lot of support, so they're very good that way. Any other questions?
Are you finding that it's more readily available for the insurance versus going to Ridery, or, I mean, because you had said that you couldn't get that covered?
Yeah, the numbers aren't equal. There are a lot of people I've tried to get Ridery for. A very small percentage of them have actually successfully gotten Ridery. Every patient, now there's only been, I think, 4 patients that I've gone the Duopa route with, but we have never not done it because insurance wouldn't cover it. So, like I say, there may be some pushback, but it's doable. I'm not quite sure why there's exactly so much resistance to Ridery, which is also very expensive, but as mentioned, the gel cartridges for the pump are quite expensive as well. So,
And all the rest of the care that's involved, you would think.
yeah, but yeah, it's one of those things I think the insurance companies anticipate, and not incorrectly so. If I had my druthers, I'd just use Ridery, because why would you use a short-acting stuff? Yeah, you can get away with it and it's cheaper, but medically there's no advantage to using short-acting stuff with a time-release capsule available. So I think they fear a stampede to the expensive Ridery, whereas they don't have that sense with this kind of therapy, but in the long run. Another comparison that's always often made is the expense of this compared to the deep brain stimulator, which is an alternative for people who are good candidates for that. And of course, once the deep brain stimulator is in, until the battery in the device runs down, there's no great expense in maintaining it. On the other hand, the expense of the surgeries to implant the wires and implant a deep brain stimulator and the implanted device itself is quite expensive. The expense of putting in one of these tubes is relatively low as surgical things go. So the expenses for say a 5 to 6 year battery life on a DBS unit, the expense is all up front. But it's actually pretty comparable to maintaining somebody on the gel cartridges for 5 or 6 years. So, I don't know, did you all consider deep brain stimulation? Or?
Well, we were told because of his dementia, he was
Yeah.
not a candidate.
Yeah, he was already beginning to dement at that point, which is, yeah, there's a real risk with implanting wires in the brain if there's already some cognitive decline of really accelerating it, and you don't want to do that. And that's probably the most common reason for not doing deep brain stimulators. But as I mentioned in an earlier talk, there can be other reasons why people can't undergo that kind of surgery, and they can easily undergo this tube emplacement because it's so simple. Any other questions? Anything else you want to tell people?
No, I think we're good.
Okay. Well, I don't think we've used up all our time, but,
Where's the cruise?
Oh, Mediterranean.
Oh, wonderful.
I never thought I'd cruise, and we went out, we got a good deal from AAA, we went out, and I loved it. So now, that's our goal, yeah.
and that's one of the great things about being able to do this sort of thing. I think it's fair to say you would never consider going on the cruise if you hadn't had the
Oh, no,
surgery.
no,
Yeah.
no.
So people can really live a much better and
Oh, even the
enriching
last
life.
cruise we went on, he froze in the airport, and then we had to wait, because we thought we'd be on time, and then they said, oh, we'll get a wheelchair, well, then you have to stay in line and wait. We almost missed the plane. I was like having a heart attack. But, so this will be much better.
Okay, well, thank you all for your attention.
Thank you.
We'll be